And we are live. Hello, everyone, and welcome to the PSBTA Technical Webinar Solutions Series. My name is Martha Ellis, and I'm the Executive Director of the Public Safety Broadband Technology Association, or the PSBTA. As an association, our primary objective is to work as an end-user advocate for all primary and extended primary FirstNet users. This includes all first responders and service providers who support response, mitigation, and recovery efforts during emergencies. We've created this webinar series in an effort to bring you the most current and accurate information on all aspects of broadband use for public safety personnel, including the latest developments in technology specific to the ecosystem. Today's webinar is the third in a series of 12 specifically designed to not only showcase the network, but many of the FirstNet-approved applications which can be found in the FirstNet app catalog. FirstNet, built with AT&T Lean-In webinars, are all about helping you optimize the FirstNet network, assuring the highest level of preparedness and reliable communications. If you have missed any of the previous presentations, please feel free to visit the psbta.org to watch the archived webinars. Before we get started today, I have a few housekeeping items. All attendees have automatically been muted to reduce background noise. Any questions should be submitted directly to us through the questions function, which is located at the bottom of the menu on the right side of your screen. Questions will be answered at the end of our presentations. We will attempt to answer as many questions as possible, yet still stay within our allotted hour. We will follow up with any questions that don't get answered during the live portion of the webinar after we finish up today. If you have further questions when the webinar is over, we also provide emails for the presenters at the end, so you can follow up at your convenience. Also, in the panel to the right of your screen, I'd like to point out that there are handouts available that should be downloaded prior to the conclusion of the webinar. We will feature 3 different applications today that are designed to help you overcome the mounting challenge of sharing information during the COVID-19 pandemic in a timely and secure manner. Our presenters today are Corey Ricketson, Regional Vice President of Pulsara, Drew Delaney, Director of Business Development at Allerio, Kurt Thomas, Training Lead at Callyo, and Bill Homer, Senior Director of Solutions Architecture, Rave Mobile Safety. They're here today to bring the FirstNet app catalog to life. They'll discuss their software capabilities, give demonstrations, and share use case scenarios to help you make critical application selection decisions for your agencies. In addition to discussing the apps, we also have Steve Devine, Director for FirstNet Strategy and Policy, who will take questions regarding our nation's most reliable wireless network, FirstNet, and how it serves as a linchpin in successfully leveraging these kinds of tools. With that, I am going to turn the time over to Corey to get us started with our webinar, Sharing Information and Data During a Pandemic.
Thank you. And welcome, everybody. I appreciate you attending. I think we've got a really good lineup today from some of the other groups as well. So again, I'm Corey Ricketson with Pulsara. I've been in the healthcare industry for 25 years. Background was as a paramedic, and then I've been in the healthcare IT space now for 15 years. So what is Pulsara? We are a mobile application that helps connect teams across organizations in the healthcare space. And I'm going to talk to you specifically about how Pulsara is helping right now with the pandemic. So if you look at typical run-of-the-mill EMS to hospital communications historically, that looked a lot like an ambulance talking to a hospital directly through an 800 megahertz radio, perhaps a cell phone, something like that, but just direct communication. Well, we're going to talk about why that radio communication directly from EMS to a hospital in COVID times is probably not the most responsible way to communicate. So this does offer a failing point. So let me explain. With COVID specifically, which by the way is sort of the new normal as we're finding, is that a lot of the precautions, a lot of the methods that we've put in place are what are going to look long-term for the healthcare industry in general. So with this, some of the failing points are, if you're talking on a radio, that's simply just not a secure connection. We know that you're not going to give protected health information over a radio. There are folks out there with scanners. There are people in the emergency department that can overhear that type of communication. It's just not something that is a best practice to be shared like that. So that's number one. Number two, we all have a lot of PPE on now, and some folks in the field have half-mask respirators, APRs. Those do not lend themselves to really good verbal communication. You sort of sound muffled like this, and so nurses on the other end cannot hear that audibly very well. And then this is a big one. We know that in these times, collaboration is key. Being able to bring physicians in on a line, or public health, or mobile testing units, people to be able to collaborate to figure out the best thing to do for patients is a best practice. And so being able to bring those resources in to collaborate on that patient's treatment is the new norm. We have noticed acutely and very quickly that video telehealth is a huge need for the industry in COVID times. And so we can't be right next to each other all the time. And so we'll talk a little bit about how the solution helps leverage that as well. And then finally, we know that the surge is a very real thing in regions, and sometimes we may overwhelm one hospital versus another. And so we definitely don't want to do that. We want to be responsible with our hospitals and be able to load balance appropriately. So if we look at this and how our solution is helping, we do have a HIPAA compliant, just meaning that there's protected health information. We've gone through all the checks and balances to make sure that that's as protected as possible. We do have a telehealth solution that is a part of our application. And that's not just between clinician to clinician. So let's say that an ambulance is at a house, they could bring in a physician from a remote location and have a telehealth consult there. But it also could be all the way back at the dispatch center when the patient calls 911. Through our application, we can actually send an invite to the patient. They can click on the text message invite, and then it opens up their phone as a telehealth device so that we can bring in physicians and other resources in order to really figure out what does this patient need. And then this is all one unified channel. So instead of that one-to-one communication that we just talked about, where an ambulance calls a hospital specifically and directly, we can bring in multiple people into group chat situations and being able to collaborate and leverage some of the things that we're talking about. So there's a term that I want you to understand before we go into the next section. They call it a MOC, but ask for Tracy folks, FEMA, this has become an accepted term. And what a MOC is a medical operations coordination cell. This is very important for regions, as the MOC helps to coordinate not only physical assets, such as PPE and other resources that regions need, but it also does serve to help move patients to the right places and help with that load balancing. So as we talk about the MOC, the Medical Operations Coordination Cells, I'm going to show you how you can leverage Pulsara in order to effectively utilize a MOC. So if we were to talk about, and I'm not bringing up the state of Texas for any other reason other than the fact that I live here, but if I wanted to load balance across a vast space, or even scaling nationally, if I'm an ambulance and I feel like I need to take a patient to a hospital, but I want to seek guidance on where's the best place to take this patient because we're in a surge capacity situation, I can, instead of sending a message to a hospital directly, I can send to a regional MOC and say, hey, I have a patient that needs a landing place. And that MOC is going to act as an air traffic control. And they're going to say, okay, here's how bad the patient is. Here's the resources we feel like are going to be needed for that patient. And here's the most appropriate location for you to transport to. That's responsible patient movement. Perhaps this region is full and staffed to capacity. We don't have any more beds. We need to send you somewhere else. So I could seek the guidance of a statewide MOC as well to say, we need to load balance. Where's the next place that can accept a patient? Because they have overreaching or overarching sense of where the capacity is, they could then pull the next regional MOC in line that would be responsible for getting this patient to a final destination and then we can link that final destination into the same channel. So if you look at this diagram, we have an ambulance, we have a statewide MOC, 2 regional MOCs, and the final hospital all in the same channel collaborating on this patient. If they needed to seek the guidance of the federal MOC, they could do that as well. So this is what the typical patient journey looks like. And this is a lot of disparate communication, a lot of endpoints. It's picking up a phone, putting down a phone, picking up a fax, looking at it, sending a text message to somebody, but it's all one-to-one communication. We're going to get rid of that, and here's how we're going to do business. So if I'm an ambulance and I need to start a patient journey, I'm going to create the channel, and then I'm going to start to build my care team. I'm going to consult with my local air traffic controller, medical control, or MOC, and I'm going to say, I need a landing place for this patient. At that point, they may need to add other resources into the channel. Maybe it's a liaison from the hospitals. Maybe it's on-call medical directors. Maybe it's public health. But once we figure out the right thing to do for this patient, which, by the way, may not be a hospital. It may be an alternative destination. It may be a lot of different things that don't look like the traditional go to the hospital. In COVID times, we've really started to think outside the box and bring in other resources. So at that point, we may need to add the destination into the channel, but we're all in the same channel now. We're leveraging live video, we're leveraging group chat, we're leveraging images, and it's a great situation to be able to collaborate. So in final, I'm just going to show you a quick kind of screenshot of how the application looks, because you want to see what the UI is. And so as you can see, the medics on scene are just starting a quick channel. This could also be an urgent care. This could be a doctor's office, a nursing home. Anyone can start the channel and seek the resources. At that point, they may start to add the images that we talked about. So these are things that are going to help the clinicians on the other end take care of this patient, pre-register early, and start that process much earlier than previous. So with that, I'm going to wrap it up and say this has been working very effectively in large regions in the United States, from Austin to Colorado Springs. A lot of places across the nation have leveraged this, and it is expanding rapidly. So I appreciate your time today. And obviously, with a solution like this, you're going to need some good connectivity. There are solutions out there that can definitely help with that, which is kind of why we're on this webinar today. So I'd like to, at this point, turn it over to Drew Delaney to talk about how we might be able to help with connectivity.
Thanks, Corey. I know firsthand that Pulsara is doing some great work in the EMS, the hospital communication space. So, you know, that was a great presentation. And thanks to Martha and PSBTEA for including us in this webinar and bringing this team together to talk about, as Martha said, how do we bring the FirstNet app catalog and applications that are dedicated to first responders to life. And, you know, the team at Allerio here, we actually, a bit of a history lesson. We all came from the First Responder Network Authority. That's the government entity that actually built and created the FirstNet network, working with AT&T to issue the contract. So with that, one of the things we learned as part of the network, sorry, I'm just trying to advance this slide here. There we go. When we were at the authority on the government side, you know, we led over 2 million individual consultations with first responders. And one of the main things we learned is that there's limitations in the connectivity solutions that exist on the market. And with those limitations, you then limit the ability to actually access the applications that are going to get highlighted today and have been highlighted in this webinar series for the past few months. So a lot of things that folks are familiar with, right? You have the in-vehicle router. The in-vehicle router is a great solution, but we all know that, you know, you can only really utilize that in the vehicle. And there's that short range of the Wi-Fi provided there. So there's limitations from a portability standpoint. When you're away from the vehicle, you lose that connectivity and you lose potentially the access to that application. In addition, you have your mobile hotspots. right? Great, they can fit in your pocket. Problem with those is that it's just a single carrier. So if you have a jurisdiction where there might be one LTE carrier that's strong on one side of the town, but then you get a weak signal on the other, you're constrained by that single carrier. In addition, they have small antennas, so you don't get the best reception from that device to that LTE tower. Additionally, there's some other options. You have the air cards that plug into a laptop or part of a smartphone or a tablet. But again, single carrier connection. You struggle in geographic areas where you don't have that full coverage from that single carrier. But also, it's a multi-step process. So we've all fumbled with our smartphones or tablets to try to set up that Wi-Fi connection. It's not simple and it's not easy to use, especially in the rigorous first responder environment. That becomes an issue. Of course, there's a tried and true land mobile radio, which is great for voice, but there's limited data connectivity available. So all the applications that you hear today are not going to be able to run on an 800 megahertz system. You have in-building systems that provide for, pretty robust Wi-Fi with maybe a fiber backhaul, but it's inconvenient and it's after the fact. You have to have that SSID and password already preloaded into your device to be able to automatically connect to that Wi-Fi. Then, of course, there's AVL, another tried and true public safety solution to know where that vehicle is, but it doesn't necessarily tell you where the individual or the crew is at that time. So with Allerio, when we did leave the government, we spent well over a year developing the solution to meet exactly what first responders asked for to really fill that gap in the market. So first and foremost, we provide the most reliable coverage on the market. We connect to 3 different major LTE networks within our platform simultaneously, so you don't lose coverage, you don't lose connectivity as you switch between networks. And we have unique antenna optimization to ensure we have fast data speeds and low latency, so you're able to establish that video connection on an application like Pulsara between EMS and a hospital telemedicine visit. Second most important is portable. So we don't have the limitations of your typical in-vehicle router. The device actually goes with you. So it's less than 2 pounds. It can fit into a defibrillator monitor bag. There's carabiners, so you can attach it to the trauma first out bag. So key is you bring the Wi-Fi with you to the patient. You don't have to bring the patient to the Wi-Fi back to the vehicle. So it really enables this new normal with telemedicine skyrocketing in the COVID environment, where you can actually have the Wi-Fi bubble around the medic, and the medic becomes that center point for connectivity. We integrate with hardware and software that first responders typically use. So whether it's an application provider, whether it's a monitor provider, whether it's any sort of hardware or software device that first responder uses, when they leave that vehicle, when they go on scene, we have full integrations with multiple of those providers. We have a full end-to-end encryption over VPN across each one of our LTE networks, so we help to ensure that HIPAA compliance, we help to ensure that CJIS compliance on the law enforcement side. And it's turnkey. Most importantly, it's one-button activation. You literally click one button and it operates right away. So from an end-user perspective, there's an ease of use. And then we offer it as a platform as a service. So on the IT side, on the administrative side, you don't have to worry about your 3 different LTE cellular contract carriers. You don't have to worry about your hardware CapEx expenditure. You have one monthly fee that goes straight through Allerio, and it's all included. Data fees, hardware, software, maintenance, upgrades, everything's packaged into our one solution. Lastly here, I'll go through some current deployments. So we have 30 paid customers and trial accounts across the U.S. It runs the gamut across emergency response. It's hospital-based EMS organizations. It's municipal government EMS, municipal fire departments, fire districts out in the west and in the east, private EMS services, search and rescue teams, as well as emergency management. And some of the specific use cases that you see are, a lot of the applications that you guys have heard of that we'll hear about today, planned events and natural disasters, search and rescue teams, specialty vehicles, incident command vehicles, and community paramedicine in AP3. So with that, I'll wrap up here and take any questions, but you'll see some sales contacts here on the screen right now. And I will pass it off to Kurt Thomas at Callyo to dive into what Callyo has to offer to the market.
Yeah, thank you, Drew. Appreciate it. There we go. Screen should be coming up right about now. So appreciate it. Thank you again, Drew. And let me thank the PSBTA crew and FirstNet for having us here to speak with you and show you our solution for sharing information during the pandemic. 1021 Police Phone, if you've heard of it before, is the most popular app in all of law enforcement. It's used by over 165,000 police officers nationwide and in over 11,000 of the 18,000 police departments across the country. The reason why is we sought to solve a really simple problem with 1021 Police Phone, and that is, as a police officer, we understand that you probably don't want to give out your personal phone number to every citizen that you interact with throughout the day. Most often, officers will block their phone number from showing up on citizens' devices. What happens when you try to call someone from a blocked number? The citizen probably doesn't want to answer, thinking it's a telemarketer or a scammer. So we developed an app a few years ago that would make calls from local, unblocked numbers to ensure that you could get those calls answered when you needed. On top of that, it's free for officers to use. The 1021 Police Phone does multiple things for an officer. On top of protecting an officer's personal number, while at the same time increasing citizen outreach, it also keeps your off-duty time off-duty. So when a citizen calls back the number they see on their caller ID, instead of being routed directly to the officer, they hear a message with two options. The first option is to be sent directly to dispatch. So if they need to speak with someone immediately, here on your screen, you can see where officers put in a number to either their dispatch or their non-emergency line that a citizen can be directly connected to. Or they can have an option to send a push notification to the officer, letting them know that the citizen wants a call back. So again, not a direct call, but a notification. Now, recently we took 1021 Police Phone and added premium features that allow officers to increase citizen answers even more, as well as some features for the officer themselves. Outbound caller ID not only shows a local number to the citizen, but will now also show law enforcement as the caller ID name as that incoming party. So again, increasing the odds that the citizen will answer that call and get the information that they need. Follow-up message is a great tool, and anytime a call is made to a citizen, regardless if it's answered, a text message goes out to that citizen, again, identifying you as law enforcement with your name and rank, which is also customizable in the settings. The citizen can easily reply to that message just with a text that says yes to request a call back. So again, no additional call needed. They can very easily reply back, and text is a very simple mode that a lot of people kind of go to these days. Now, some features from the officer side, citizen caller ID allows the officer to see the name of the citizen who's requested a callback in their app call history. So rather than just seeing a phone number, they can actually identify that specific citizen. Lastly, unlimited records retention that allows an officer to see full contact history that travels with their login. Log out on one device, log in on another, the complete history will still be viewable between those apps and those phones. So what I'm going to do now is I'm going to ask my partner Brad to initiate a call through 1021 to me. Brad is posing as the officer. I'm the citizen here. So he'll initiate that call out, and we'll see in just a moment that call will come in. There we go. So the call's coming in. So he, as the officer, is calling me, the citizen. And we can see here again, the caller ID shows law enforcement. Even though Brad is actually calling from California, it's showing up as a local 727, a Florida area code. So we're identifying that officer. He is an officer. I answer the call. He provides me the information that he needs to relay to me, and we go ahead and disconnect that call. Thank you, Brad. Much appreciated. We are currently now kind of beta testing the 1021 Police Phone Enterprise for departments as a whole, that in addition to the premium features, will also have a department badge that will show up on the outbound caller ID. So it shows law enforcement, but it also shows that department. So again, you're just identifying yourself as law enforcement. That way there's no question at that point. And also it's going to make it easier for admins to keep track of officer call records as a whole. Now, expanding on 1021 police phone, and this is kind of a great story that's specific to COVID-19. We've had 1021 police phone for a while, but back in April, we get a call from a large California tech company that was going around asking chiefs of police how they can better help serve law enforcement with technology during COVID-19. And the response that this company received was, we'd really like, as officers, as chiefs, to be able to two-way video, like a FaceTime, with residents if we can't respond directly on the scene for all non-emergency calls. Especially during this time, social distancing, trying to make sure that the officers and the citizens remain safe. That was kind of a big issue. Now, Callyo already has a one-way video platform called 1021 Video, but what we really wanted to do was introduce that two-way video between that officer and the citizen. So all the while protecting the officer's phone number and identity and maintaining an important log and records of those communications. So what we did in under 30 days, which was an amazing effort by the Callyo teams, is we launched and created an entire additional mobile app called Nectar. Now, Nectar stands for the non-emergency call to a resident. And the way Nectar call works is a citizen simply installs a Nectar app on their phone, iPhone or Android, it doesn't matter. They verify their phone number just one time. They don't even need their email or name or any other identifying information. Once verified, it enables their phone for the two-way video calls. But how does it work? So odds are you may be the 1 out of 1 in 5 officers that are already using 1021 police phone. All you have to do is just continue to use 1021 police phone as you already are or normally would. What's interesting here is that when I call someone with 1021 police phone as an officer, if the resident does not have Nectar, it'll connect via audio just like the call previously with Brad, just the audio. But if they do have Nectar, it will connect via video automatically. So now I'm going to kind of play out the role as the officer making a 1021 call to Brad. So I'm going to go ahead and initiate that call. I'm going to enable my video. So there we go. So I'm on a Nectar call. Hey, Brad, how's it going? Doing excellent. So me as the officer, I'm now communicating with Brad. Brad is my citizen. He has Nectar on his device. So again, it allows us to still be in great contact, great communication with that citizen while maintaining a distance and making it safe for both ourselves, the officer, and the citizen. Appreciate it, Brad. Thank you much. Now, isn't that awesome? So again, just by dialing 1021 police phone to reach a citizen, they can now answer my call on video and still be, quote unquote, face to face without any exposure to that citizen or the officer. So you might be asking, how do we get the word out about Nectar if you're working for a department? So if you remember the outbound text message that goes out after the 1021 call, it'll also tell the resident if you would like the next call to be over video, download the free Nectar app. But you can also, as a department, use your own communication channels, that your agency already has, such as your Twitter, your Facebook, all the social media channels to say, hey, download the Nectar app so we can better serve you with that two-way video. Now, even better is that while 1021 police phone is already free for officers to use, during the COVID-19 crisis, video calls through Nectar is also completely free. And again, paired with FirstNet, built with AT&T, officers get that preemption, that priority on the network for your audio and video calls when you need to reach citizens most and get them the information that you need to. So thank you for your time, much appreciated, for your interest in 1021 police phone and Nectar and letting us go ahead and show you our solution. Now I would like to introduce the next speaker, Bill Homer with Rave Mobility.
Thank you very much, Kurt. And thank you to the PSBTA for hosting this collaborative presentation today. As mentioned, my name is Bill Homer, and I'm the Senior Director of Solutions Architecture at Rave Mobile Safety. I've been with Rave for 13 years, and I am very pleased to have an opportunity today to present for you all. First, a little bit about Rave itself. Rave Mobile Safety serves over 8,000 customers in thousands of communities across the nation. With 15 years of public safety innovation, Rave has partnered with first responder agencies and developed public safety communication solutions on our public safety grade infrastructure to deliver information where it is needed and when it is needed. That infrastructure, responsible for reliably processing 20% of the nation's 911 calls and over 1.2 billion messages a year, is the same infrastructure that the solutions we will speak to today reside on. The Rave Panic Button, a FirstNet listed mobile application operating on Android and iOS platforms, is one such solution. This solution was originally developed specifically to address the time to awareness and thus time to respond for active threats within the K-12 environment. Currently, it's the most widely deployed school safety application in the country. Over the course of the past 7 years, the application has been continuously enhanced to provide a number of additional capabilities beyond active threat. It is these enhancements which allow for its use not only for active threat, but also now for medical, fire, and other emergency scenarios, and also leveraged not only in K-12, but in government buildings such as libraries and courtrooms, but also corporate facilities as well. The solution is able to be positioned because of its flexibility as a very valuable communications conduit during the COVID pandemic as well. It's statistically known that in any type of an emergency event, time saves lives. Much like Corey from Pulsara noted, historically, reporting of an incident and its associated response has followed a very linear or sequential flow. There is an initial reporter who's the first person to see something that's happening. That person's going to want to communicate that quickly. They're going to communicate and connect with 911. At this point, potentially only 2 people are aware something is happening. Logical flow to dispatch and ultimately awareness, not only to the first responders, but also to on-site personnel, of course, takes a period of time. First responders are dispatched, of course, arrive on scene, of course, sometimes arriving after the conclusion of the initial event or threat itself. And I can't tell you how many times we've heard someone on site say, I didn't know anything was happening until I heard the sirens and looked out the window. The Rave Panic Button, through the power of FirstNet, consolidates the awareness to 911, first responders, and on-site staff, allowing for an instantaneous situational awareness and delivery of important incident details. The Rave Panic Button is activated by pressing and holding the button applicable to the type of emergency. As I mentioned prior, the app was originally focused on active threat scenario. It was literally a single one big red button. However, quickly, as we deployed it nationwide, it was expanded to allow for choices based on the type of event, which is of course important for situational awareness and proper channeling of communications and response. This means that because of the power of FirstNet and based on the type of incident being reported, you can get the critical data that you need as soon as the 911 call is being placed. First responders and on-site responders are immediately notified via text, email, push notifications to the app, providing location, type of incident, and important information such as floor plans, emergency procedures, specific to the type of event, critical facility contact details, and more. It is very important to note that 911 is simultaneously connected and additional information is also passed to 911 and incident command as well. In the realm of enhancements, we also recently introduced the option of status checks. So what's a status check? Well, initially we envisioned it as this. During an incident, it's important to track trends and gather updates of situations impacting individuals on scene. This feature provides a central command point with the ability to solicit specific feedback from those associated with a facility. These check-in questions and responses can be customized to determine injury information, evacuation or lockdown statuses, missing personnel, etc. And though not a focus during design, like who knew it, right? This has also been used for purposes of COVID-related daily wellness checks. Ultimately, the ease of customization to meet a variety of different use cases has positioned the application to be a valuable resource in the COVID recovery plans across the country. For first responders, these check-ins deliver response, individual details, and also location information associated with the individual that's responding. We also added a feature called Staff Assist. The idea bore itself from interactions with a variety of organizations across the country. Not all incidents rise to the level of needing an external response. So leveraging Rave's messaging infrastructure means that the app can actually be used as a trusted communications platform for all forms of messaging. Most commonly, Staff Assist is used for minor medical incidents or a minor disturbance to get the right internal responders on scene to address an incident. But it also allows mid-incident communications, which can also be quickly delivered to first responders. Much like check-ins, when we were in the lab working on this feature, we had no idea that it would be put in use in a pandemic. But Suffolk County has done just that, leveraging Rave for communications, surrounding outbreak updates, facility closures, etc. And these Staff Assist templates can be created to send pointed communications to the right internal and external responders, sharing real-time information. COVID-related check-ins are certainly a focus. In a variety of recovery efforts, they are a key means of gathering information, and the Rave app can deliver and capture this information quickly and effectively. Through a series of recurring daily polls, health checks can determine the overall wellness of your and other organizations. Each day, a new request for updated wellness information can be delivered, gathered, and ultimately acted upon, whether it be for tracing use or simply decision-making or decision validation. Specific instructions can be delivered immediately to the screen of the individual who you've solicited and who has responded to your wellness check. Leveraging a full customizing HTML response, you can drive individuals to the correct behavior based on what they are reporting back to you. The flexibility of the platform is also exposed in a fully customizable content library. This allows for capture and sharing of important content, such as emergency procedures, reporting procedures, and yes, certainly in these times, COVID-specific guidance, symptom checkers, test site info and location, urgent care info, etc. Opening up communications paths is critical. And within the app, we've also detailed a two-way communication solution allowing for chat sessions to be opened by individuals and info shared freely. These chat sessions, as we call them, can be broken down by categories so that the right offices field the inbound information and respond in like driven based on the information provided. Lastly, high-risk areas can be defined so that entry with the app into these high-risk areas can be met with additional information about the risk, or even those wellness checks we previously discussed could be delivered directly to the app. Think about entering a particular area, and once you get close to the facility, you're being presented with an option or ability to be able to follow through with your wellness check. By leveraging the power and reliability of FirstNet, these solutions can be deployed quickly to organizations and responding agencies. We value your time and efforts and thank you for the opportunity to discuss our FirstNet listed offerings. This concludes my presentation. Martha, I'll go ahead and pass it back to you now. Thank you very much.
Fantastic. Okay, great. We've gotten some good questions in from our viewers, and so I'm going to go ahead and start posing those. I'm going to start with Steve Devine, who didn't actually give a formal presentation today, but we certainly want to hear from you, Steve. In regards to the backbone of all of these applications, right, is that secure network and reliable network that comes forward with FirstNet. So one of the questions that came through was what has changed with FirstNet's offering as COVID pandemic has kind of seized the country in a whole new different response model?
Thanks, Martha, and thanks to the PSBTA for this opportunity. We're certainly glad to present and to talk about FirstNet with this great group here. FirstNet's really been working to improve coverage across the U.S. For a number of years now, and this means more at-risk patients can be treated in place without leaving the comfort and safety of their home. FirstNet's the only nationwide high-speed broadband communications platform dedicated to and purpose-built for America's first responders and the extended public safety community. It's providing the connectivity healthcare providers need to deliver premium care, even if the doctor isn't there in person. And a great example of this is some of the COVID test sites we've seen during the pandemic, where communities have established locations. We've had the opportunity to triage those locations to see if those locations were sufficient for both the coverage and the capacity needed, and whether or not additional resources such as our response operation group or our SAT-Colts or our deployables were needed to bring to that location to provide the connectivity that they needed in that community.
Fabulous. So when we're talking about serving the country with this LTE network, FirstNet, how does that impact the rural areas, tribal areas across the country that maybe fell short in the past with their LTE connectivity?
Sure. You know, FirstNet is the nationwide network, and there was a lot of discussion that as to the benefits of a single nationwide network across the country, and that network includes urban areas, of course, as well as rural and tribal areas. And those areas, we've got both obligations and commitments to cover in those areas. We've got build-out requirements within our contract with the FirstNet Authority that speak to some of those requirements. Plus, we have our response operations group that, in addition to filling in coverage and providing capabilities in those areas, also responds to outages and natural disasters and areas across the country where the network was working fine, and due to some incident or some event, which may include not necessarily a coverage need, but a school shooting or some event like that necessitates additional capacity. We've got the deployable resources and a commitment to deploy those resources in a time frame that is with the goal to meet those community-based requirements, whether they be rural, whether they have regular coverage, whether they have some coverage and need additional capacity. Between our existing macro coverage and our deployment process, we're here to support the network on a nationwide basis, regardless of where those incidents occur.
Okay, and since you brought the ROG, the Response Operations Group, up, one of the questions also is, how long, once you have one of those assets on site, how long can we expect for those to stay in support and operation?
That's a great question. Thanks, Martha. The deployment process is really an extension of our partnership with public safety overall. We've had deployments where they're there for a number of hours until public safety feels comfortable, and whether the network's been reconstituted or public safety feels that the deployable is no longer needed. And we've had deployables in place for months on end after hurricanes in the Gulf and across the eastern seaboard, that it took that long for the public safety people to feel comfortable with the network being back in place. So it's really about what best meets the public safety's needs. They make that request, and really we don't pack it up and bring it back to be available for additional deployments elsewhere until public safety's comfortable with it and comfortable with their experience going forward. So the ROG supports that experience, those deployables support that experience, and it's going to be there as long as it's needed.
So as the leadership is weighing out the expense of a large campaign, response campaign like that, should they be concerned about the cost of pulling one of those assets in?
Another great question. The assets and the deployable program is part of the FirstNet customer and part of our commitment to that FirstNet customer. So as a FirstNet customer makes a request for a deployable, that's part of their FirstNet subscription. That's part of their FirstNet access, and there is no cost for that deployment and for the duration of that deployment. That's part of our commitment, our ongoing commitment to support the nationwide public safety broadband network, and we'll continue to do that across the country.
So it's not like the gas meter that's going a mile a minute. It's your time as your cost is going up. All right, outstanding. That's really a comfort, I'm sure, to all of the leadership out there in public safety. So let's move over to Corey for a moment, and with Pulsara. One of the questions that came in was, how quickly can EMS teams adopt an application like what you're offering? And does it take a long time to set it up and learn it? I guess kind of the question more or less is it intuitive, and will we be able to get it into the hands of our crews and actually have it working in fairly short order?
Sure. Yeah, no, I mean, it's with the solution, it's very scalable. So I think that instead of trying to bite off the whole cookie, let's think about this in bite-sized chunks. And if you're going to do something, just do something. Don't stop. And go ahead and take that step forward. And what we've recognized, I was able to get in the Austin-Travis County region, 21 hospitals and a lot of EMS on board within a matter of a couple of weeks. And so, when you look at training, a 5-minute video, a quick session, and the users have it. And then what you find is that if we just start with some simple interactions and get one piece of the puzzle solved, we can continue to build on that. That could be a process over weeks, months, years that you start to go, you know what, there's other resources I want to add to this channel in certain circumstances. So let's reach out to Pulsara and have them connect them as well. And now with that network communication, leveraging the broadband network like you have, it really becomes a situation where you could connect the dots very quickly.
So what I'm hearing you say is that leveraging this application is very scalable, because another question that came in is our community isn't too large, but we still have real communications issues between various public health organizations and first responders. How might Pulsara help our response to COVID and after? And I mean, if you want to expand on that expandability.
Yeah, in some of those rural areas, even, that's where they need it the most, right? They don't have the same resources as the big cities. So if we can offer even a small rural EMS service, the ability to have a medical control, even if it's not their own, but it's something that they can connect to, and then be able to get resources added in where they could have a telehealth consult with a on-call doctor somewhere, that's a great situation for them. So that's a small application. That's a small lift right there. And I would start there. That's a great place to start. And it doesn't take much time to get something like that up and running.
Fantastic. So they don't have to overcommit. They can certainly pick and choose what's going to work best for them within their jurisdiction. Great. Hey, Drew, I have a couple questions for you. How is Allerio different from other Wi-Fi routers on the market? Are there any key distinctions?
Yeah, absolutely. And that goes back to the first slide, second slide in the presentation that I put up there. I think there's 3 key differentiators with, your existing in-vehicle routers that public safety is used to. And that's really what we're trying to disrupt and where we see the market going. First and foremost is it's portable, right? So here's the device itself, less than 2 pounds. You can carry it with you. There's carabiners. You can attach it to a trauma bag. You can attach it to a first out bag. It's small enough. You can fit it into the side pocket of your Zoll monitor bag, LifePack 15, the new Philips Tempest Pro that's coming out. So that's the first key differentiator, is that it's portable, right? It has a battery with it. You're not stuck to an in-vehicle router. As I said before, you take the Wi-Fi with you, and I'll have to credit my colleague Todd York with this quote. You take the Wi-Fi with you to the patient. You don't have to take the patient back to the Wi-Fi of the truck. That's a paradigm shift in EMS patient care, right? So you can now provide that care at the patient bedside without having to worry about, do I have this single carrier connection there? does my in-vehicle router have Wi-Fi that can get me into that building, that can get me into that office building or apartment building far enough away? So that's the first thing. Second thing is that it simultaneously connects to 3 different networks. So typically, you have a single carrier, you have 2 carriers that are in an in-vehicle router. You have to either call the cell provider to get them to initiate that surge in capacity. It's all built into ours. So no matter what, if you're driving down the road and you're doing FaceTime or you're using Pulsara and you're doing a video conference, there's no disruption. You can switch from AT&T FirstNet to any other LTE carrier. There is no disruption in your coverage and in your user experience. You still have that video conference. So that's number 2. The number 3 is ease of use. There is one button on here, power on, power off, and that controls every Wi-Fi device that you have around you that is pre-configured with our platform. So you don't have to set up any electronics. You don't have to connect any RF frequencies, nothing. You literally push a button just like a MiFi hotspot, on, off, and you're ready to go.
Hey, fantastic. Thank you. Well, we're really hoping that nobody has to switch to any other networks, but in the case that they do. Okay, Kurt, I have a question for you on the 1021 phone. The question is, can a user delete record retention? How long will the records be retained?
Good question. The records are retained indefinitely, especially on the premium. Actually, the free version, so there's 2 different sides. There's the free version and there's the premium version, kind of like the paid access service. The free version, the records, all you have to really do is just uninstall the app, reinstall it, and that'll basically flush the records, at least from their view. With the premium service, those records are retained indefinitely. And again, they travel with the device. So even if you uninstall it from one device, install it on another device, log in with your email address and passcode, those records are going to be available and will travel with you through that account. So depending on which one you're using, I don't believe we have the premium where it's set up to delete just yet. We're always making improvements as we go along based on customer feedback and so on. So that may be something in the future, but with the difference between the free version and the paid version and the records retention there has that option.
Okay, fantastic. So as far as Nectar goes, are the calls encrypted?
Yes, the calls are end-to-end encrypted, not recrypted, and they're never stored. So we don't actually store any of that data, like the actual recordings, anything along those lines. It's not recorded, so they can't be accessed by us or even a third party, anything along those lines. So it is end-to-end encrypted for both audio and those video calls.
All right, fabulous. Bill, have your solutions been used on a large scale in any location, and can you share a little bit of anecdotal stories regarding that?
Yes, absolutely. So as I had mentioned earlier on, the solution is one of the most widely used school safety application in the country. With that, we actually have a number of statewide deployments. The state of Louisiana, Oklahoma, Delaware, Arkansas, and the District of Columbia as well have leveraged this. And in terms of implementation, our experience, both large and small scale implementations, we can have single facility, single corporation, single municipal facility stood up in a matter of days, whereas these larger statewide deployments obviously span out over a couple of months, 2 to 3 months typically for an implementation. So quite a great deal of experience with both large and small implementations. To Corey's point, you've got to be ready for any type of situation. The communications are difficult in small arenas as they are in large.
Okay, fantastic. Going back to Allerio briefly, being a mobile router, can you speak a little bit to the retention of priority and preemption across that mobile router on the FirstNet network?
Yeah, absolutely. So we are actually one of the first FirstNet embedded IoT providers. So what that means is we basically wholesale FirstNet service. So when you buy an Allerio device, you're buying FirstNet service. So you're buying priority and preemption, you're buying access to band 14, you're buying access to the entire AT&T network and the priority and preemption that runs across that. So no different than buying any other OEM device through FirstNet or through that OEM. It's the same service for that the FirstNet connection via our device.
Fantastic. Steve, something else that just occurred to me is we're really talking a lot about the extended primary user in the context of COVID. Can you talk a little bit about the uplift process and how the extended primary user can leverage that as their communities are getting stressed with the COVID responses?
Sure. Thanks, Martha. What Uplift allows an administrator or an on-scene commander to facilitate uplift and bring a higher priority and quality of service to extended primary users. And the best example of that is when there's electrical lines down as a result of a vehicular accident. The law enforcement, the fire EMS, they all need the utilities listed as extended primaries are going to be able to have priority to come in to clear the scene and allow them to do their job. So that's a great example of where a need would occur, an incident would occur where a need results in an extended primary user to have as much priority and maybe even more, at least for the duration of the live wires being down. So the ability for a FirstNet user, whether it be a extended primary or a primary user, to be uplifted to a highest level of priority and quality of service during that particular incident. That uplift lasts for a period of time. It can be renewed, and it allows a heightened area of level of quality of service to be offered to both primary and extended primary users at an event or an incident.
All right, fantastic. With that, I'm going to just go around very quickly and ask for a couple closing comments as we're getting close to the top of the hour. So, Steve, we'll just start with you since your little mic is hot right now.
Great, thanks. We appreciate everybody's input here. FirstNet continues to evolve and to grow on our journey supporting public safety. Over 1.3 million users and over 12,000 agencies. And it doesn't seem like it's been in place that long, but it continues to provide the necessary resources for the first responder community across the country. We're honored to do that, and we look forward to the support of all those participating here today.
Corey?
Yeah, thank you. This was actually very valuable to me, as some of you said. Seeing some of the other products and some of the ideas is really awesome. So hats off to everybody. If you have the slight bit of interest in Pulsara, hit the website. Our marketing team does a great job of helping to continually educate the community on what our services are. And actually, to get started with Pulsara, that's absolutely free. The simple interaction of being able to talk to a hospital and include EMS in those conversations is a completely free offering with us, and you can sign up right online.
Okay, fantastic. Kurt?
Yeah, thank you again for the opportunity to present. This is much appreciated. 1021 police phone, while it is specifically for law enforcement only, it's kind of restricted to use by law enforcement. The Nectar is for citizens, so citizens can download that information or that app. That way they can, control those calls. They can get those video calls and have that face-to-face interaction. Any questions about that, you can always go to your app store. They're available on all the app stores. 10-21.com. 10-21 is where you probably want to search for it and check it out. We appreciate, again, the opportunity to present. Thank you guys so much.
Okay, Drew?
Thanks, Martha, and thanks again to you and the PSBTA for having us on. As you had said at the outset, and I reiterated, I'm going to reiterate it again, right? This is all about bringing the applications to life, right? And we're the odd duck in this group. We don't have an application. We actually help bring these applications to life with our connectivity solution. So if there's any jurisdiction out there that is struggling with connectivity, no matter who you're connected to, obviously FirstNet being the primary network on our device. But if there's any coverage gaps, if there's any issues, if we can help get you connected to all three of these applications or any other application that's on the market today, that's what we're here to do. Whether it's in a pandemic, whether it's in 911 response, our device is portable, it's easy to use, and that's what we're trying to solve in the market. So thank you again.
You bet. Bill, last word.
Thank you, Martha. And to reiterate, everyone else, thank you very much to the PSBTA for putting this together and allowing us to share our information with everybody. Certainly from a Rave Mobile Safety standpoint, I think I probably said it 2 or 3 times in the presentation. We didn't roll out of bed saying we need to build something for a pandemic. We just iterated through ease of customization within the applications themselves that allow for leveraging the platform for a number of different use cases. And here we are, like we'd know it ever, in the middle of a pandemic, allowing for ease of communications from first responders and individuals within facilities alike. So the opportunity presents itself to increase that communication capability, and we're glad to do so. A quick note on Rave Mobile Safety in general is that it is a much larger platform offering. I mentioned 911 before and notifications. Those are all things that quite literally tie together to the applications that have been presented. So we're delivering information to 911 quickly and effectively, along with the calls that are being placed there, but delivering the floor plans and the other details that are of course important to response and information flow. So take a moment to get a chance to go out to ravemobilesafety.com, check out the different platform offerings that we have there, as well as the solutions we've discussed today. Great time today, and appreciate your efforts across the board.
Thank you. Thank you to all of our presenters. We hope you all enjoyed our webinar today and felt that it was time well spent. We deeply appreciate your participation. And again, we are the Public Safety Broadband Technology Association, and we want to be your advocate for all aspects of FirstNet utilization. By being here today, you help support our efforts to continually bring you cutting-edge information about FirstNet, the nation's only fully dedicated mission-critical first responders network, and all aspects of the ecosystem that is being built purposefully for your advantage. Please visit our webpage at thepsbta.org for more information on the association, our upcoming webinars, and recordings of all of our previous webinars. In appreciation for your attendance today, you will receive a free membership to our association for 2020. Please let your friends and peers know that by attending one of our webinars, it includes a free membership to the PSBTA while we're all trying to navigate our current situation with COVID. Finally, consider visiting allthingsfirstnet.com as well. Their team continually compiles valuable information on FirstNet and the developing ecosystem. This concludes our webinar, sharing information and data during the pandemic. Please join us in an hour for our webinar on how to deploy an innovative and cost-effective body cam solution. Thank you again for your time.